Hello everyone and welcome to our fourth and final episode on this series on liposuction. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon specializing in aesthetic surgery and I'm the director of the plastic surgery division at Skinzone Clinic, Mumbai. Today we will be speaking on one of the things that every patient should know prior to getting their liposuction surgery done, which is the safety of liposuction. We'll be talking about this series in two parts. The first part being about what are the precautions or the care that you need to take before the surgery, and in the second part we'll be speaking about what are the care that is to be taken after the surgery by you as patients to decrease any risks or complications associated with liposuction. Safety wise, liposuction is perhaps one of the safest surgeries out there. The only caveat being that it is done by a board certified qualified plastic surgeon in a good surgical setting. This in itself will take care of a lot of the risks and complications that are associated with liposuction. I do not want to enumerate all the risks or the complications that are associated with liposuction. This will be done in detail, point wise, as they relate to you during your consultation with your plastic surgeon. What I want this video to be about is to empower you as patients with information about what you can do prior and after the surgery to reduce the risks that are associated with liposuction. Prior to the surgery, you will need to have at least one in-person consultation with your plastic surgeon. Here you will be asked about your medical and your surgical history in detail. My advice is complete disclosure. Do not hide anything from your plastic surgeon, be it any previous surgeries or any medications that you are on. After a detailed examination, your plastic surgeon may ask you to get a sonography or a CT scan done. This is usually advised in patients who have had previous surgeries or are suspected of having a hernia. From our previous videos, you know that we do not go anywhere near your internal organs. But in a hernia or in scarring due to a previous surgery, these internal organs may come to us. That is to say that the internal organs may come out through a defect in the muscle wall right under your skin. If this is not picked up prior to the surgery, it may cause injury to these internal organs. You will also be asked to perform some other tests required for general fitness for your surgery, including some blood tests. My advice to you, follow your plastic surgeon's advice to the T. No smoking. This is one rule that you as a patient should absolutely never compromise on, no matter what, prior to your surgery. Doc, how about one cigarette? One cigarette. I mean, all my friends are out there and it's so chilly and I have that meeting later and my nerves are all jingly, I need that. No. Doc, how about that just one puff? It's rude to tell no to a friend. Yeah, come on, doc. Absolutely not. If you're a smoker, you're just kidding yourself if you say that you can stop at one puff. Apart from the very well publicized side effects of causing cancer, cigarettes also cause one of the most hated problems that plastic surgeons face, which is reducing the blood supply to your organs, including your skin. What this will cause is delayed healing and you not getting the results that you desire after the liposuction. But much more importantly, it may cause one of the worst and perhaps the dreaded complication after liposuction, which is skin necrosis. In this, the skin over the area where the liposuction has been done sort of dies and sloughs off. So, no smoking for 3 weeks to a month preferably prior to your liposuction and during your recovery period after the surgery. Usually, these are really good substances to have which act as immunity boosters and help to keep your blood flowing through your vessels in your body. But during your surgery, we don't want this blood flowing out of the vessels, for they may cause complications such as hematomas, which is collections of blood, or things such as excessive bruising after your surgery. Substances that act as blood thinners include green tea, herbal supplements, vitamin E supplements, garlic, turmeric, fish oil, and a whole other list of things that will be told to you and a list given to you during your consultation. We'll also try to post a link in the description below. So try to avoid these substances at least 1 week prior to your surgery. Pressure garments are basically compression fabrics that need to be worn over the area where liposuction has been done after the surgery. These, however, need to be made in a customized manner prior to the surgery. How they are to be worn and for how long, we'll discuss later. Right now, what I want you to know is why you need to wear these pressure garments. When we do liposuction, we remove fat from a layer between the overlying skin and the underlying muscle. This leaves a gap in this area. Our body absolutely abhors this gap and fills it with fluid. When this fluid accumulates in discrete pockets, it is called as seromas, which is perhaps the most common complication associated with liposuction. When it is a generalized collection of fluid over your entire area of liposuction, this slowly becomes harder over time and causes a phenomenon what is called clinically as fibrosis. This absolutely destroys your results of liposuction. So it is of the utmost importance that you wear your pressure garments. Liposuction is usually done as a daycare surgery. Reach the hospital in time so that you're nice and relaxed come the time of surgery. Remember the medications that you need to take prior to your surgery, and if any you have been asked to omit. So as a patient, these are all the things that are under your control prior to your surgery that you can do to reduce the risks associated with liposuction. If there are any other specifics, these will be told to you by your plastic surgeon prior to your surgery. So that brings us to the end of the first part of this fourth and final video in this series on liposuction. I hope you liked it, and do join us next time when we'll be speaking about the care that a patient needs to take after the surgery to get the best out of your liposuction results, and so that you can avoid the risks and complications associated with liposuction. This is an absolutely essential video to watch if you're looking to have your liposuction surgery done. Do write in the comment section below if you still have any queries regarding this video or anything else regarding liposuction or plastic surgery in general, and I'll try to answer them. Or you can DM them to us on our various social media platforms, or visit our website, mail them to us, or give us a call. See you